You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I am a holistic nutritionist and a professional cancer coach. Trauma affects everyone differently, and how we react to trauma impacts our recovery. On today's show, we are discussing a groundbreaking approach to not only healing from trauma, but experiencing growth from it. And our guest is Dr. Edith Shiro, author of the new book, The Unexpected Gift of Trauma. Dr. Shiro is a clinical psychologist in private practice in Miami, Florida. She specializes in trauma and post-traumatic growth, holding space and guiding her patients to achieve greater potential and higher consciousness. Dr. Shiro is co-founder of the Trauma and Resilience Center, board member of the World Happiness Foundation, and an active member of Cadena International, providing humanitarian aid and disaster prevention worldwide. She has worked at the Clinic for Survivors of Torture at Bellevue Hospital, the Cambodian Refugee Clinic at Montefiore Medical Center, and the Human Rights Clinical Support Network at REFUGE, among others. She continues to offer workshops in trauma-based therapy for mental health professionals since 9/11. She is a frequent guest on various TV shows, podcasts, and radio programs, and we are very lucky to have her with us today. We talk about post-traumatic growth, how growth and transformation can emerge from unspeakable tragedy, and how our everyday choices affect our mental health and our reaction to trauma and suffering. This is a wonderful show, everyone. I hope you stay with us. We will be back in just a few minutes to talk with Dr. Shiro.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the program. Our show today has been pre-recorded, so no opportunity for calling in, but please do follow us on our social sites. We are on Instagram, Twitter, and Facebook. We are at the Health Hub RMC on those locations. And if you ever have follow-up questions, if you need to contact any of our guests, this is where you hit us and we can point you in the right direction. Dr. Shiro, welcome to the show.
Thank you, Kathy. I'm so happy to be here with you and with your audience.
Oh, I'm so happy to have made your acquaintance. What you are doing is phenomenal. Your book is amazing. And it cuts across so many different types of people because trauma in some way, shape, or form affects us all. But before we get into that, how did you come to be an expert in this space? One such that led you to write such a fantastic book.
Thank you so much for saying that. It really means a lot to me. It's my first book. And really what has happened is that I have always been passionate about the human condition and the human existence. And as a clinical psychologist, the topic of trauma, but more than trauma, really the topic of transformation and post-traumatic growth, like what happens after somebody experiences a difficult situation or a challenge or a loss or something that shakes their lives. Like, what do people do with that? And since I was very little, really, I was surrounded because I come from a family of Holocaust survivors, refugees. I also grew up in a community of immigrants and refugees. And I've always seen this around me. Like, some people What's the difference that makes some people do really well and thrive and transform, and other people stay stuck and develop PTSD and other kinds of symptoms? And really, I always want to know, okay, what's the difference? What really, how does that happen? How people really deal with their everyday lives, because even their big traumas, but also everyday traumas, like how do people deal with that, and what makes the difference to have a better life, to have a healthier life, to develop your potential. So my curiosity has led me to ask this question around, to treat my patients in many different ways, and then lately to really share my experiences, personal and professional, really for 25 years in this book. So I'm very, very grateful that I had the chance to do it.
When we talk about trauma, are we talking about those life-shattering events that happen in life? Are we talking about a buildup of everyday small traumas? Is it the same thing? What's the difference? Like who does this book resonate with?
Yeah. So trauma it means a wound, right? And this is a psychological and emotional wound. And it means that people can experience life-shattering events in which the way you understand yourself, others, and the world is completely shattered, and you have to rebuild your life from scratch. For others, is experiences that are more chronic or that are more subtle, or that are more in the realm of relationships that can be very traumatic, but they don't have the impact of a big trauma in terms of identifying it. But for example, having a mother that is not emotionally available is extremely traumatic, but it doesn't look like a trauma. It's harder to identify. Having microaggressions in like a racist or discriminatory behavior in our society, that's traumatic, but it doesn't look like it. Being bullied in school, or being rejected by your friends, not having a sense of isolation. These are all traumas, and not all of them are identified like you are a victim of war or a victim of sexual abuse. It's like, so it really depends how you want to define it. One of the things that I say in the book is that trauma is a subjective experience, in the sense that you are the only one that can determine what is traumatic for you. Nobody else can tell you, no, you're not traumatized, or yes, you should be traumatized. It's how you experience it. Mm-hmm. And the other thing is that trauma is relational. It's in relation to others. Is whatever happens to you, how the people around you supported you, listened to you, acknowledge it. That's what makes it more traumatic than not.
When you're working with your patients, are you trying to get to the root of trauma? Does that make any difference? Or in your experience and what you're sharing in your book, is the idea to acknowledge trauma and move on from it?
No, I love that question, because from there comes all the different approaches of psychotherapy, right? Mm-hmm. So you can have psychoanalysis, in which it's all about your relationship with your mother and your father, right? And your childhood events. And then you have cognitive behavioral, in which is like, forget about everything that has happened to you. Let's just focus on your behavior, and everything in between, Mm-hmm. So it's not, I don't think it's one extreme or the other. From my approach, I think in general, really, we all go through traumas. Some are bigger than others. Some are more earlier than other traumas. And the idea is to acknowledge and validate them, because most of the time, the root of our suffering and the root of our addictions and the root of our being stuck comes from traumatic experiences. But that doesn't mean that you have to stay in that narrative. What it means is that once you validate and acknowledge, the most important thing is to move on. And move on means to process it. So it's like that Buddha is saying that the only way to the other side is through. You cannot just jump to the other side, to the other side without going through the process. And that's really what I'm trying to, one of the messages that I'm trying to say in the book is that, yes, it's important to know what happened to you, but it's also important to have the courage to sit with it, to give it a name, to identify it, to make it part of your life in a way that allows you to transform it, to change the narrative, to rewrite your story. Because otherwise it's always going to be a resistance. There's always going to be a defensive response to that. There's always going to be a trauma response to whatever happens to you. And that can last for your whole lifetime. I don't know if I'm responding to the question.
No, absolutely. You see people have you don't see people all the time, but one person can have one trauma, another person's trauma extremely similar. And the reaction is completely different.
Yes.
I'd like to ask this question because someone who's an expert like you may have done research into this area. Is there a genetic component to how we deal with traumatic events?
Kathy, I love your questions. This is such good to the point because there's a chapter in my book. Yeah. And not many people ask this. There's a chapter in my book that is called Floating Factors. And my research during all these years has been about looking at what are the precise factors that make a difference. And like anything else about humans in life, it's not just something that is predetermined or is one variable, right? It's not like, if you've experienced trauma as a woman or as a man or as a rich person or as a poor person, or, if you're from this culture or not that other culture, it makes a difference. No, it depends. It depends. But all these variables make a difference. The culture where you come from, the family support that you have, the age in which you experience trauma. Is it acute? Is it a one time, or is it chronic? Has it happened over time, over and over? What are your genetic components that you have that make you have a tendency towards depression or anxiety or psychosis or neuroticism? All of that makes a big difference, and all of that are factors that are going to inform the experience of trauma and also the experience of healing. So there are cultures, for example, in which recognizing, let's say, for example, sexual abuse for women, it's not even part of the conversation. We know that there are countries and cultures in which that there's not even recognition for that. There are other cultures, like here in the United States, where you have more freedom to talk about it, when you can go to therapy for that, right? Mm-hmm. So that makes a difference. We also, and like that, many other variables. But we also know that there's, from the genetic perspective, to respond to exactly what you were asking about genetics, we now know there's something called epigenetics, and I'm sure you've heard of it, in which it's not only the information that we carry in our genes that determines our behavior, our decision making, our experiences, our personality, and our habits, but also the very experiences that we have in our everyday life can modify the expression of those genes, right? That's what epigenetics is. And depending on the circumstances where you are when the trauma occurs, right? Or how you are experiencing your life in the moment, that genetic information can change. And I say that with a lot of hope. And I say that with a lot of positive, with a positive twist, because instead of thinking that trauma, it predetermines our life and it's like a life sentence to be depressed or to have post-traumatic stress disorder for the rest of your life, we actually have the power and the capacity to change not only how we want to handle our trauma and how the attitude that we confront the trauma, but also the genetic information, right, that we carry and how we want to in some way acknowledge and modify that to our benefit and to our transformation. So it really, you see how many variables I'm mentioning that are all part of of handling trauma. Gabor Mate, who's like one of a really well-known psychiatrist these days, is in fashion these days. He always says that trauma is not what happens to you, but it's what happens to you inside of what happens to you. Meaning, like, it's not the event itself, it's how you interpret the event, how you live that event, like how much support you had in that moment. So a child that has gone through a loss, for example, if he has adults around them that are accompanying that child and allowing that child to express their feelings and letting that child process that information and facilitate a healing moment, is going to leave that trauma very different than a child that doesn't have anybody to listen to them, that it becomes very isolated with that experience, that gets disconnected from the world because of it, that has no reliable adults around. Like, and it can be the same event, right?
Mm-hmm. Well, okay. On the back then of the epigenetics and the myriad of factors behind how trauma impacts an individual, then can we say with a degree of certainty that everyday choices affect our reaction to trauma? How we choose to deal with life on a daily basis can either set the stage for a more, not positive, but for a better outcome of trauma versus someone who is impacted negatively a lot more?
I'm going to say yes and no, because on the one hand, yes, the choices that we make every day and the attitude that we have every day speaks to stronger resilience, right? So people that are more resilient, that develop tools to confront difficult situations, that are more able to deal with difficulties in life or with challenges in life, of course, they're going to do better. On the other hand, people that don't have those tools and are not that resilient. And I know I'm going to say something a little controversial about resiliency, and I love that because it allows people to think a little bit further in terms of resilience. Not everybody has those tools, and not everybody develops or has the capacity or has the privilege of having developed tools and resources to deal with difficulty. But sometimes breaking and touching rock bottom and going to the darkest place in your life is precisely what allows you to say, I have no choice but to move forward from this and to grow from this. And those are the people sometimes that become stronger. And that's one of the points that I make in my book, is that precisely that breaking, that shattering, that place where you have nothing else, right, to lose, is where you become that huge quantum leap of transformation. And that's what gives you sometimes the wisdom and the knowledge and the ability to then be stronger in life. In fact, one of the things that happens because of post-traumatic growth is that people become stronger. They have a stronger sense of self. They become more confident in their lives. They understand better their priorities. Sorry for the noise. They're more clear in what's meaningful to them, what's their purpose in life. So it's a tricky thing. People that are very resilient and have so many tools and they're very strong do well in life, but they might not get to this transformation.
Well, I mean, some people don't have the resiliency tested until there's a traumatic event, right? So how do many of us don't know how resilient we are unless we've been through a trauma. Is that
absolutely? Yes, exactly. And going through that trauma allows you to develop that resilience. If you didn't have it, that's exactly what happens. That's what I think that's where we have the choice. That's the part where we say, okay, we can either succumb to this situation, right, and be destroyed and stay there, or we can decide to take this as an opportunity to develop this resilience and to develop a stronger sense of self. And yes, we don't know it until we go through it. I agree with you. Yes.
And there's no preparing for that trauma for a lot of us. Those of us who have had a trauma in our lives, that there are certain life experiences that are expected, correct?
Yes, yes.
And although they can be traumatic and emotional, they don't hit like other traumas. And so for a lot of us who have had a trauma, an illness, a very sudden death, a bad relationship, it's in the moment that we find out how resilient we are. And, you wonder if you can have tools built up ahead of time, or it's just a knee-jerk reaction to the trauma in that moment.
I think for some people, it's a knee-jerk reaction in the moment and say, okay, I find myself with powerless and hopeless and helpless. And that's where people develop their stronger capacities to survive. But also, I think we can prepare. I don't know if the word is prepare, Kathy, but I think having more awareness and consciousness about ourselves and working on ourselves every day on developing our connection with ourselves and with others, I think that's what makes a difference. And sometimes we have to be shaken to get that awareness. And for some people, really, having like a shocking experience or having a very, very difficult experience is what allows them to become more open or more conscious or more aware. And for some others, and I hope it can be the truth for most of us, that we don't need to go through a traumatic event in order to become more conscious and more aware and become more connected with ourselves and with others in order to really, handle our everyday situations and our bigger situations as well.
It is a constant working on ourselves every day, and just small little steps, I think, that, can help lay the foundation to a reaction to trauma. Before I get on to my next question, I think we should take a break here because we'll really push this half if I get into my next question. Everybody, we're just going to take a quick break, and we'll be back in just a couple of minutes here.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the program. We are talking with Dr. Edith Shiro. And can you say your name for me? I know I'm not saying it properly.
No, you are. It's Edith Shiro. Perfect.
Oh, close. That was good. Excellent. I imagine, and actually, I can't say that this is a novel question of mine because I did some research on you ahead of time. And I know that this topic of growth post-trauma, or, the unexpected gift of trauma, which is the name of your book, might have made some people wince a little bit. What is this how did you approach this, and why did you want to, wave the waters with this title?
Yes. And I'm smiling, even though you don't see me, because I love, a lot of people say to me, how can you put trauma and gift in the same sentence? How can you do that? And I say, because I've seen it every day in my office. I've seen it over and over in the collective traumas communities that I've worked with. I've seen that transformation happen. And I know it's a contradiction to think that from something so painful, from an illness, from a war, from a loss, from a death, something good can come out of it. And I tell you, I'm very careful when to say it, because when you're in the midst of the crisis, when you're dealing with the depression or the sadness or the shock of what happens, saying something like that to the person that has not even begun to acknowledge what happens can be very delicate, right? You can say, oh, don't worry that you have this chronic illness. Don't worry because you're going to get something wonderful out of it. No, I'm not going to say that at that moment. But slowly, as the person gets their support, as the person becomes to process what's really going on, as the person develops the tools, knowing that there's a light at the end of the tunnel, Kathy, I think makes a huge difference. And my book, The Unexpected Gift of Trauma, I wanted to give it as an opportunity of hope, as a message of hope to say, yes, there's something wonderful that is awaiting for you on the other side. If you only trust this process, I can tell you that people have been transformed over and over from something difficult that has happened to them, for something traumatic or challenging. And even though you don't see it now, even though it's very difficult even to imagine that this is something that can happen, I can tell you that that's the case, not once, but many times. And that's why I give a framework, a 5-stage framework, and like an understanding, like there's a roadmap to this, and there's like a pathway to get there, you know?
Well, and I can't, the word process sometimes gets overused, but when you're dealing with a trauma, it is a process. And I can say this personally, it's a process. And I don't think personally you can prioritize or say one trauma is worse than another. It's your trauma. It's your, it's like, it's your disease. It's your, your loss. And you can't prioritize one trauma is worse than the other. But what you can say, I think, listening to you and going through a trauma of my own when I got my diagnosis of breast cancer, it is a process. And there's that space that you need to go through things, and I think sometimes we're very hard on ourselves when we're trying to deal with trauma. And I think it would be really beneficial if, we don't have to go into each stage in depth because that's what the book is for. But if you could walk us through the 5 stages on a very, high level, I think that would be great.
Yes. And Kathy, thank you so much for saying what you said, because yes, I always tell people, and from experience, that overcoming trauma is not from one day to another, and it's not like pushing a button. It really takes time. It takes time. It takes effort, right?
And reevaluating and rethinking, and and exactly. Trying to find some growth, like you said. I mean, your book is titled that, but I think for people that are either going through a trauma or reacting from a trauma, you need to give yourself space, and you need to be able to give yourself a break,
Absolutely,
a break.
Absolutely. So that's why the first stage is 5 stages. The first stage, and it's more like a description of what already happens to the person. These are not stages that I've invented. These are stages that I've observed over and over and over. So tell me if this resonates with you, Kathy. The first stage is the stage of awareness. It's like you're in radical acceptance. Yes, okay, I have breast cancer. It takes a while because after the shock and after the denial and after the avoiding and after all the trauma responses that we all do, right, you finally can get to a place to say, I radically accept that this is what I have. And that sets the motion of this process, and say, okay, because I'm radically accepting that this is what I have, there's a validation and acknowledgement and recognition that these are my symptoms. This is what's happening to me. It has a name. I'm identifying it. I know this is happening, and I'm not going to resist it. I'm not going to avoid it. I'm not going to keep having my addictive behavior that keeps, keep this away. I'm just going to embrace it. And then that takes you to the second stage, which is the stage of safety and protection, the stage of awakening. It's like, not only that I know what's happening to me, but I'm ready to ask for help. I'm ready to reach out, to get to a place, a safe space where I can talk about it, where I can do something with it, where I can share, when I can be seen in what I'm going through, right? So it's not just you with yourself, but it's you in relationship to others. And then you get to the third stage, which is stage of new narratives. This is a stage of becoming. So it's like you begin to develop new narratives. You begin to see things in a different way. You begin to become curious to say, okay, what other ways there are of living my life? So I don't know if this happened to you, Kathy, but it's like the way you eat is different. The way you have relationships is different. The way you see life is different. You begin to take into account different philosophies. This is where people become very curious about other ways of being. They start believing in different things. They go away. They try new things. You really develop a new narrative of your life and of your new belief system of yourself, of others. Then you get to the fourth stage of integration, in which you not only acknowledge yourself, but you also acknowledge, all where you come from, because you are who you are together with the trauma also. It's not just like denying it, but together with it. And then the fifth stage, which is of course my favorite, which is the stage of wisdom and growth. This is where you really get to a place of transformation. You say, I'm clearer with my priorities. I'm stronger. I have a stronger sense of who I am. I have a more meaningful life. Not only that, Kathy, but I mean, you're a perfect example of this. It's what all your learning and your wisdom and your understanding, your growth, you also share it with others. This is where people become very clear in their life purpose and what they do and who they are and how they want to live their lives and give it back to the community. So this is, these are 5 stages, and I would love to, for you guys to see it in the book and read it in depth and see there are exercises with each stage and things that you can identify with and where are you in the stages. Some people call me and say, oh, I'm in stage 2 or I'm between 2 and 3. And it's like a good thing to know where you're heading also. This is where it's taking you and this is where you're heading.
Well, that leads me to another question that I had. Who is your book for?
So my book is first of all, it's for every single person in this planet. I want everybody for whole humanity to have this book. It's really geared towards people that not only the people that are going through trauma that can identify these 5 stages in themselves and have a roadmap to know what's going on with them, but also for people that are caretakers and that can give hope to those who are going through trauma, the ones that are there, the family members, the friends that are saying, okay, I'm here with you and I'm facilitating this process for you. And I'm going to hold this hope for you as well. And of course, it's also for people that are in the helping profession, right? For all those professionals, mental health, psychologists, doctors, caretakers that might not consider post-traumatic growth as a possibility. And I want people to know, yes, this is a true possibility when you see patients, when you work with people, to let them know that they can look forward to this, that they can look forward to the possibility of post-traumatic growth, that it's not just staying in that place of like, yes, I'm going through a trauma and this is where I am. Yes, I have a diagnosis and that's all there is. But to know that there's something else, there's a lot more. And that if you're willing to go through that process, you can get transformed on the other side.
So you as a therapist, and if we're talking about, somebody reads this book who's a professional in this space, and they love how you have laid out post-traumatic growth. Does that affect how you work with people in the process of a trauma?
What do you mean? It affects in what way?
So if obviously you are trying to work people through a trauma and trying to see them have growth from the trauma. But if someone is going through a trauma, is this a different part of your therapy, or are you guided by these 5 principles and you're showing people how they can grow versus dealing with the trauma? Because this would really set the stage for a different way to practice healing from trauma.
And because I believe that most things that I see, most symptoms that I see in my practice, and I think most decisions and behaviors that we have in our everyday life are informed by some traumatic event, and that are informed by traumatic responses that we have. And I'm not saying that everybody has to go through through a breast cancer diagnosis or through a sexual abuse behavior or through war. I'm not saying that everybody experiences that. We all
Oh, Dr. Shiro, we seem to be losing you.
Our vulnerabilities, right? We all have our weaknesses, and that's what informs our defenses, right? We develop. Can you hear me? Can you hear me now?
Yeah, I can hear you now.
From our weaknesses and our vulnerabilities, we develop our traumatic. Okay. Can you hear me now? Sorry about that.
That's okay. I can hear you now. Yeah, you kind of faded before. Okay.
Sorry. from our, I'm going to say this again, from our vulnerabilities and our weaknesses, we develop these trauma responses, right?
Mm-hmm.
We develop defenses, we develop our ways of coping, our coping mechanisms. So every time somebody comes to therapy or somebody suffering because they're not comfortable with their lives, because there's something that is bothering them, right? Because that's when people begin to say, I need to change something because I'm not 100% comfortable. Because if you're comfortable in your life, even with your behaviors that are not 100% healthy, you're not going to go to change. You're not going to go to therapy. You're not going to go to do something different in your life. So when you're uncomfortable enough and when you're suffering enough that you are willing to change something, this is where you have the opportunity to look at to what were those experiences that triggered the way that you're defending yourself, right? So some people have some people like become more obsessive. Some people become more anxious. Some people become more depressed. Some people become more addicted. We all have, behaviors that some of them can be extreme and some are not. But that's what I'm saying is like, even when you're not coming to deal with a specific trauma, looking at those root causes and validating them and acknowledging that and identifying that can be, I think it's necessary no matter what, because that's really what guides you then into making decisions in your life and instead of being reactive, then you're more able to regulate your emotions and take a pause and decide how you're gonna respond to whatever is coming to you. You see what I'm saying? So even when you're not working with huge traumatic events, the fact that you can acknowledge where your weaknesses and vulnerabilities coming from and how aware you are of yourself, it allows you to regulate your responses. So no matter what, these 5 principles or these 5 stages or these stages, are part of the treatment no matter what. And I think it's important to do it in every occasion. Because sometimes just treating the symptoms or just saying, okay, yes, well, let me give you medication for this, or let me, treat whatever behavior you're having right now, but you're not really dealing with the real thing, it's not going to last.
A holistic approach to trauma. I like it.
Yes.
I like it.
Exactly.
When was your book published?
So last month. It's a new baby.
It's a new baby.
Yeah.
Well, it's an awesome book. It's an awesome achievement. Where is it? A lot of our listeners are in Canada. Where can we get the book?
Perfect, because it's being sold in Amazon. It's being sold in different bookstores. I don't know if there's Barnes and Nobles in Canada, but the book is not only on the websites, but also on Audible, in Kindle. Really, it's impossible not to get it. You can find it anywhere. Yeah, no, really, it's very easy to get it. Even if you don't want to get it physically, you want to get it in audio form. It's available as well. And I think the bookstores in Canada sell it. I don't know if just Barnes & Noble, but there's all kinds of more independent bookstores that sell it as well. And if you request it, they send it to you. And if they don't send it to you, please call me. I'll send it to you. Okay. So,
So how can people get a hold of you if we have trouble?
So, yes. So my Instagram, which is where I'm very present, is Dr. Edith Shiro, Dr. Shiro. My website, which has a link to the book, www.dredithshiro.com. And if not, Kathy knows where to find me, and just ask her. And really, I would love to hear, what resonates with you, what you think about the book. Put a review on the Amazon when you get it in Amazon. Like, all these things are helpful to really continue the conversation on how we integrate trauma into our lives and how we become really more conscious human beings that we need it so much in this society,
We really do. And it just doesn't make sense to spend a life trying to avoid trauma. It's going to hit you one way or the other. I congratulate you. This is wonderful. Everybody knows when I have an author on, I'm amazed at the the ability to sit down and write a book. So congratulations. It's being received extremely well. And I really want to thank you for taking time out of your really busy schedule to join us. I think our listeners will really benefit from the show.
Kathy, thank you so much for what you're doing and also for being such a beautiful example of post-traumatic growth. And I want to make sure I say this because you've transformed from the little that I hear from you, and I can't wait to hear more. You've transformed your trauma and your, all these challenges into beautiful things, not just for yourself, but also for others to benefit from all this wisdom. So I really appreciate the work that you're doing. Thank you.
Thank you very much. It's very kind of you to say. Everybody, we will talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.